We're with Dr. Brian Miller from Boehringer Ingelheim Vetmedica. And Dr. Miller, thanks for joining us here at World Ag Expo here in Tulare, California, where we are basically sitting in the dairy building where dairy producers are walking by and asking how they can treat their mastitis. You know, mastitis, when we stop and think about it, it's inevitable in some ways for the dairy producer. But you're here to tell us a little bit about, culturing of milk. And before making a mastitis treatment decision, is that a good idea?
It is a good idea, Bill, because unless you know the cause of the clinical, you don't know which path to take in terms of treatment. There are a variety of mastitis pathogens that cause mastitis. Not all are treatable, and not all should be treated. So having a decision and arriving at a diagnosis through culture results guides that treatment decision.
Let's talk about gram-positive and the treatment of that. And first off, explain that.
Okay. When you say gram-positive, there's two types of bacteria, gram-positive and gram-negative, based on differences in the outer bacterial cell wall and how they stain in a lab. Typically, when we talk about gram-positive organisms in today's modern dairies, those are environmental streps, environmental staph, and some Staph aureus, and sometimes occasionally strep ag. Those are the predominant gram-positive organisms. When we speak of gram-negative, those are the coliform group primarily. E. coli, Klebsiella, Citrobacter, and Enterobacter. There are other gram-negatives like Pseudomonas and Serratia, but for the most part, those are the coliform type organisms. So the focus of therapy, Bill, typically is directed towards gram-positive pathogens because they are less likely to self-cure. They're the most responsive to treatment, and left unchecked within a dairy have negative consequences in terms of production losses, increased risk of new infections, spread to other cows at the milking process. So those should be the focus of intermammary therapy.
And so for those that are on the farm right now and aren't culturing their milk, or they don't have a vet connection in that regard, what should they do?
Well, I think above and beyond, having a vet connection is very important. The use of antimicrobials needs to be done in a judicious and prudent manner. The treatment protocols should be designed with the help of a veterinarian and the guidance of that veterinarian. So I think that should be part of an overall herd health protocol. And again, help direct the therapy towards those cows that need it. Culture, at least for mild or moderate cases of clinical mastitis, and having a 24-hour turnaround time is best, because then you put the appropriate therapy with those cows that require it, and you avoid needless therapy and overuse of antibiotics for those cows that do not require it. And the best source of information to help make an appropriate treatment decision and to guide the culture program is the local veterinarian.
It's good to know. Hey, thanks for stopping by and visiting with us. Appreciate it.
Appreciate the time, Bill. Good to see you. Thank you.
It's Dr. Brian Miller from Boehringer Ingelheim Vetmedica here at World Ag Expo.